Welcome! Today we're talking about contagious diseases in tortoises and turtles, what signs to watch for, how these illnesses spread, and simple steps you can take at home to protect your pets and your whole collection. As chelonians grow in popularity, disease spread risks rise. We'll review the major contagious illnesses, what they look like, and how better understanding, prompt veterinary care, and smart management improve survival, breeding, and repopulation efforts. Here's our roadmap of contagious diseases we see in chelonians. This overview sets up the specific pathogens you'll hear about next. Mycoplasma has been documented in multiple genera: Terrapene, Gophorus, Testudo, Geochelone, Indotestudo, and Pyxis. So we screen broadly, even when animals look normal. Typical signs include upper respiratory disease, conjunctivitis, anorexia, and lethargy. We use appropriate prescription antibiotics, supportive care, and choanal flushes. Prognosis is generally good, but treated animals can remain lifelong carriers, so relapse under stress is common. Pasteurella often appears with respiratory disease and can occur alongside mycoplasma. We see it in Gophorus and Geochelone. Its full significance is still being worked out. These obligate intracellular pathogens are contagious to multiple vertebrates and can be zoonotic. Signs range from upper/lower respiratory disease and lethargy to inability to dive and organ lesions. We confirm with PCR and treat with supportive care plus appropriate antimicrobials. Prognosis varies with severity. Salmonella is often part of normal reptile gut flora and is zoonotic. Many carriers look fine, but isolated captive cases show emaciation, shell erosions or discoloration, and even death. We diagnose by culture and provide supportive care with targeted antimicrobials when indicated. Tick-borne agents matter. Borrelia burgdorferi and Rickettsia spp. are zoonotic and associated with ixodes/hyaloma ticks. B. turcica is tied to Testudo but with no human cases documented. Routine tick checks on new arrivals are essential. Chelonians host numerous herpes viruses, marine, freshwater, and tortoise strains. In tortoises, we monitor testudinid herpesviruses TEHV1, -2, -3, -4, and others. TEHV1 appears in Europe, e.g., Russian pancake, with low morbidity, mortality. TEHV2 in US desert tortoises. TEHV3 across Europe, USA, Africa with higher morbidity, mortality in Testudo and Russian. TEHV4 has been found in clinically healthy bowsprit tortoises. Additional types reported in leopard, pancake, Argentine, and Russian. Look for rhinitis, conjunctivitis, stomatitis, and glossitis with diphtheroid membranes, neck edema, and in severe cases, CNS hepatic or pulmonary involvement. We diagnose with PCR or serology, plus virus isolation/histopath. Antivirals reduce replication in the lab but have limited patient success. Recovered animals are considered carriers for life. For disinfection, use 10% bleach. Environmental inactivation occurs over weeks and faster in sunlight. Adenovirus cases have been increasing since 2009. Documented species include redfoot and leopard tortoises, ornate box turtles, Sulawesi and impressed tortoises, and Burmese stars. Transmission is fecal-oral or direct contact, so strict hygiene and isolation matter. Disease is most common in young or immunocompromised animals, and concurrent illness is common. It can cause hepatitis, enteritis, esophagitis, splenitis, even encephalopathy. Watch for sudden death, anorexia, lethargy, mucosal ulceration, palatine erosions, plus nasal/ocular discharge and diarrhea. We diagnose with PCR and histopathology. Treatment success is very limited. For example, Sulawesi tortoises had 87.6% mortality. Prognosis is poor, and recovered redfoot tortoises can be asymptomatic carriers for life. These viruses are environmentally persistent, making disinfection challenging. Ranaviruses are highly contagious causes of illness and death in chelonians, with increasing cases reported worldwide since 2003. Clinical disease has been described in Hermann's and gopher tortoises, soft-shelled turtles, redneck disease, eastern and Florida box turtles, red-eared sliders, and Burmese star tortoises. The mechanism of transmission is still unknown, and cases are seen in both wild and captive populations in the US and Europe. Next, we'll look at the clinical signs you might notice at home. Edema, anorexia, lethargy, red skin lesions in soft-shelled turtles, conjunctivitis, and neck cellulitis. We use PCR with specific sequencing to avoid false positives from insect viruses. Treatment success is limited. Strict biosecurity is critical. Well documented in snakes, and less common in tortoises. A multi-country study found approximately 5.5% seropositivity across 202 tortoises, with higher percentages in Spain, UK. Signs include lethargy, rhinitis, conjunctivitis, emaciation, respiratory distress, and death. First detected in juvenile Testudo and Sulawesi tortoises, previously called virus X. Clinical signs include soft shells, kidney disease, and death. Transmission is still being clarified. It's often mistaken for nutritional secondary hyperparathyroidism. Though best known in snakes/lizards, crypto is increasingly reported in chelonians, Sonoran desert, Indian star, pancake, Russian, radiated, gopher, and others across multiple countries. Highly contagious and a concern for collections. Though best known in snakes/lizards, crypto is increasingly reported in chelonians, Sonoran desert, Indian star, pancake, Russian, radiated, gopher, and others across multiple countries. Highly contagious and a concern for collections. Expect chronic diarrhea, decreased appetite, pica, poor growth, weight loss, lethargy, and soft shells in juveniles. We diagnose with PCR, with sequencing, and acid-fast fecal smears. Intranuclear coccidiosis was first identified in 1990 and has since been reported in many chelonian species: radiated, impressed, leopard, forstons, bowsprit, spider, Galapagos, flat-tailed tortoises, eastern box turtles, Arakan forest turtles, and more. It's been documented in the US and Germany and is most common in captive tortoises. The life cycle and route of transmission aren't fully understood, and morbidity and mortality can vary widely, even within the same group. Clinical signs are non-specific: anorexia, lethargy, loss of normal daily patterns, increased respiratory effort or mouth breathing, rapid weight loss or gain, mild conjunctival/nasal redness, ocular or nasal discharge, gasping, subcutaneous edema, cloacal mucosal ulceration, and death may occur within days of signs or after months of treatment. Stress and thermoregulatory changes can accelerate disease progression by reducing immune response. Even animals that seem to recover can become asymptomatic carriers. Diagnosis may include cytology of nasal discharge, biopsy/histopathology of affected tissues, and quantitative PCR on swabs of the conjunctiva, oral/choanal mucosa, and cloaca. Care focuses on optimal husbandry, isolation, supportive care, and hospitalization as needed, plus prescription coccidiostats. Prognosis is guarded to poor. Even survivors may have permanent organ damage and can succumb months after treatment. Hexameter is a contagious flagellate affecting GI and urinary tracts, including kidneys and liver, leading to renal damage and failure. Documented across many freshwater turtles and tortoises. In practice, we often see it in recently imported Russian tortoises. Signs include failure to thrive, anorexia, weight loss, and death. We use antiprotozoals, supportive care, and environmental decontamination, including cleaning feces off shells to prevent reinfection. Prognosis depends on the degree of kidney damage. Hookworms, roundworms, and flukes can cause non-specific illness. Treatment relies on prescription antiparasitics tailored to species and parasite. Ticks and mites act as vectors and can cause anemia with heavy loads. We combine environmental control with antiparasitics, never ivermectin in chelonians, plus physical removal and prevention. Next, we tie it together with disease prevention basics you can apply at home and in collections. Chelonian diseases are emerging as popularity increases. Understanding prevalence in wild and captive populations helps prevent spread within and between collections, and guides smarter, earlier care. References for further reading are listed here if you'd like to dive deeper into any topic we covered. Thanks for joining us today. We're Tree of Life Exotic Pet Medical Center, a locally owned, exotic-only practice for birds, reptiles, and small mammals. If today raised questions about your pet or habitat, we'd love to help. Book online 24/7 at treeoflifeexotics.vet or call 4805300370. We're open Tuesday to Friday 9 to 6 and Sat 9 to 12. Closed Sun Mon. New patients welcome. Upfront estimates, payment plans through Cherry, and Pet Assure savings available. If your pet has urgent signs, trouble breathing, severe lethargy or bleeding, please call, don't book online. We look forward to caring for your finned, feathered, and scaled family.